If you're enrolled in Medicare, there are certain dates you can't afford to ignore. October 15th, the kickoff of the Medicare Annual Election Period, is one of them. The fall annual election period is when people who are already enrolled in Medicare can make changes to their Medicare Advantage plans or their Part D coverage. In this video, we'll talk about the things you need to do to get ready for it. In September, each Medicare insurer sends out an annual notice of change. If you have a Medicare Advantage plan or a Part D prescription drug plan, be sure to watch for this letter. You will not get one for your Medigap plan because Medigap plans do not change their benefits each year like Advantage plans and drug plans do. More on this towards the end of this video. Now, back to the annual notice of change letter. It will show you everything that is changing inside your Medicare Advantage plan or your Part D drug plan. Things like the plan's monthly premium, the plan's annual deductible, copays for your medical services, and copays for your medications. It will also discuss any upcoming changes to your plan's pharmacy network or its list of covered formulary drugs. You should read it very carefully so you aren't caught off guard in January by a change that you didn't expect. With that said, let's go over the 6 things that you can do during the Medicare Annual Election Period, and then I'll share with you the one thing that this period is not for. Number 1, you can switch from Original Medicare to a Medicare Advantage plan. If you have been enrolled in a Medigap plan for a while and had several rate increases over the years, you may be thinking about switching to a Medicare Advantage plan. Before you do, watch our video on the pros and cons of Medicare Advantage plans to familiarize yourself with the things that are different between Medicare Advantage plans and Medigap plans. People are often attracted to Advantage plans that have low premiums or even what we call zero premiums. But if you've watched some of my other videos, you should know by now that low premiums are not always the best for you when dealing with your healthcare and medical insurance, which is arguably the most important insurance that you will ever own. But if you are considering Medicare Advantage, be sure to check the plan's directory and confirm that your doctors are in the plan's network. Then check the plan's drug formulary to find out if it covers all of your most important medications before you enroll in the plan. Remember, if you're currently enrolled in Medicare Part A and B and you switch to a Medicare Advantage plan, you must continue to pay for your Part B premium. So if a Medicare Advantage plan that you like has a $50 monthly premium, that's in addition to the Part B premium that you will continue to pay, and you'll want to remember this when you are budgeting. Number 2, you can switch from Medicare Advantage to Original Medicare. Sometimes Original Medicare offers the flexibility and value that you're looking for in health coverage. For example, if you're planning to travel around the United States a lot during your retirement or maybe spend the winter in a warmer climate, the service area restrictions in Medicare Advantage plans might not work for you. So you can switch back to Original Medicare during the annual election period, and that way you can use your benefits with any provider who accepts Medicare anywhere across the country. Before you make that change, if you are planning to pick up a Medigap plan to go alongside that Original Medicare, you'll need to apply for that, and you'll likely have to answer health questions to get that coverage. Some people are unprepared for this, and it often then comes as a surprise. Applying for the Medigap plan early in the election period to make sure that you get approved before you drop your Medicare Advantage plan is a really good idea. Number 3, you can switch from one Medicare Advantage plan to another Medicare Advantage plan. It's not uncommon to find a new Medicare Advantage plan in your area that you think will work better for you than your existing plan. Late in 2018, the Centers for Medicare and Medicaid Services approved a new set of expanded benefits for Medicare Advantage plans, with coverage for some unusual things like home meal delivery, non-medical transportation, and over-the-counter medications and devices, for example. More insurers are introducing new plans with these benefits each and every year. You may be able to switch to a new Medicare Advantage plan with the expanded benefits that matter most to you. Number 4, you can enroll in a Part D prescription drug plan. If you're switching from a Medicare Advantage plan that includes Part D back to original Medicare, you'll need to add on Part D coverage or risk a late enrollment penalty unless you have drug coverage from another source like the VA. Creditable drug coverage can also be from an employer plan, yours or a spouse's, or a retiree plan too. If you have that existing drug plan coverage, your plan must provide you with a certificate of creditable coverage when you leave that plan. Be sure to keep it in your records to avoid the Part D penalty later on. Number 5, you can switch from one Part D plan to another Part D plan. Don't assume that your current Part D plan is the best one for you until you've compared all of the available plans in your area for next year. For example, if you're an insulin-dependent diabetic, the fairly new senior savings model plans that may cap your insulin costs at $35 per prescription can save you a lot of money. It's a good idea to see what's out there and how a new plan will affect your medication costs. Number 6, you can drop a Part D plan altogether. If you currently have standalone Part D with original Medicare and you switch to a Medicare Advantage plan with Part D built in, you will drop your current prescription drug coverage. Or you may also want to drop Part D if you or a spouse goes back to work and you get medication benefits through an employer plan. Any changes that you make during the annual election period will always become effective on January 1st of the following year. You probably noticed that I didn't mention switching into or out of Medigap plans as part of the annual election period. That's because the annual election period in the fall has nothing to do with Medigap plans at all. And most important for you to know, the annual election period in the fall does not give you a free pass into a Medigap plan without you having to answer health questions. Instead, Medigap plans have their own unique rules and restrictions. For most people, there's only one time you can buy a Medigap plan without answering questions about your health, and that's during the Medigap open enrollment period. The Medigap open enrollment period is a one-time window during which you can't be turned down for pre-existing conditions. That period starts the month you become enrolled in Part B, and it lasts for 6 months. Then it's gone. You can drop your Medigap plan whenever you want, and you can apply for a new plan at any time of the year. The problem is that you will have to pass medical underwriting in most states to do so. The Medigap insurer can refuse to sell you a plan if it feels your medical health history presents too great a risk for them to cover. Now, maybe you had some rate increases over the years, and you're thinking you'd just like to check rates for Medigap plans, and of course that's fine. But I would still recommend waiting to do that in January, because during the annual election period, the underwriters are swamped with applications from all the people trying to leave Medicare Advantage plans and go back to original Medicare, and it can take weeks for the underwriting. So if you can, concentrate on your Part D for now and save the Medigap plan shopping for January or for at your next policy anniversary. Now is the best time to start gathering information about changes to your current plan and any other plans available in your area. Make a note of premiums, deductibles, co-payments, and annual out-of-pocket limits. If you're in a Medicare Advantage plan, make sure that your current doctor will still be part of the plan's network next year. If not, think about whether you're willing to choose a new doctor or whether switching your plan to keep your doctor is best for you. As always, the team here at Boomer Benefits is ready to serve you. We can evaluate the Medicare Supplement or Medicare Advantage plans in your area to find that perfect fit. Just give us a call to see how you can take advantage of the Medicare Annual Election Period.